As of today, the latest figures that we have globally are that there are 77,617 cases of coronavirus that have been diagnosed and confirmed around the world. Sadly, over 2,300 people, 2,356 people precisely, have lost their lives to coronavirus. We also know that tomorrow 266 people from the third group who have been in quarantine in Australia are set to return home. They have been at the Howard Springs temporary quarantine facility in Darwin. They came on the evacuation flight from Wuhan, which the Department of Foreign Affairs and Trade arranged, and which Qantas very professionally and thankfully carried out with the support of our AUSMAT crew. What that has seen is a third successive and successful quarantine operation being completed. There have been no cases recorded in any of those first three operations. The general population numbers in Australia remain at 15. That has been stable for some weeks. 10 of those 15 have recovered and returned home. It is important to advise that precisely as the Chief Medical Officer had anticipated and as expected, cases have been diagnosed within the new group that have come specifically from the Diamond Princess. This reaffirms the decision we made, not just to conduct an airlift, but to ensure that these people were in supervised quarantine in a separate area within the Howard Springs facility. There are now 6 Australians who have been on the Diamond Princess and have been brought to the quarantine facility in Howard Springs who have been diagnosed with coronavirus. All are being or have already been repatriated in some cases by Medivac to their home states. 1 to Western Australia, 1 to South Australia, and today the 4 new cases, which brings to a total of 6, will include 2 to Victoria and 2 to Queensland. All are well and in a stable condition, but they have been diagnosed and therefore they've been put into an isolation and containment process before being medevaced to their hospitals. As I say, this was both anticipated and forewarned, but it also explains the reason we made the difficult decision to impose a supervised quarantine regime. More broadly, however, all governments have received advice from the medical experts, the chief health and medical officers of all states, territories and the Commonwealth. And if I may, the advice received is that COVID-19 has been contained in Australia with no new cases in the general population in the last week. In addition, the advice that comes from the medical officers goes on, there has been an apparent slowing in case numbers in other provinces of mainland China, suggestive of better containment. So in short, what we have seen is a reduction from over 700 cases a day outside of Hubei across mainland China down to below 70. And this is a very important international development backed up by what we have seen in Australia. And so as a consequence of that, what is known as the Australian Health Protection Principles Committee has recommended to the federal government and to all of the governments that current containment measures need continual review for proportionality, and in particular they have recommended that the ability of Border Force to provide case-by-case exemptions be continued, and that in particular that should include consideration of Year 11 and 12 secondary school students from mainland China, excluding Hubei. And so we have considered that, accepted that advice, and there will be a limited number of cases on a double green light basis. The Commonwealth has to approve and each state and territory has to approve, but this advice from the health officials has been unanimous. It has been accepted by the Commonwealth and the states, and then it will be up to each individual state to adhere to the circumstances.